Welcome to another edition of Inside Town Hall. I'm Jim Cameron, your host and the program director here at TV 79. We are in this program talking with the folks that help run town government here in Darien. And our return guest, perhaps the most frequent guest we've had over the years, because there is so much to talk about in his department's work, is David Knauf. Do you pronounce the K or is it just Knauf?
I do pronounce the K. Thank
Knauf.
you.
Okay.
You got it. You got it.
Knauf. I used to
Yes,
call
sir.
him doctor, but he reminds me he's not a medical doctor, even though he is the health department director. David, welcome back to Inside Town Hall.
Thanks, Jim. It's been a while. I don't think that we've talked since we had the pandemic.
Well, I think you've been a little on the busy side, so I didn't want to bother you when you were.
All right. Now that I have all this extra time, thanks for filling it up with this conversation. I appreciate that.
Well, before we talk about the work of your department, let's talk a little bit about your background. What's your academic experience and professional work in this field of town health?
Well, I have a master's in public health that I got from the University of Connecticut and a master's of science in engineering science that I got from Rensselaer. I have been in the public health field. My very first real job out of college was working for the state health department, which I spent about a year and a half there. And then I worked at Farmington Valley Health District, which is in the northern part of Connecticut, for many years. Do I have to say how many?
No, you don't have to.
Oh, good. Thank you. But it was a long time. And, and it had to do a lot. We did a lot with environmental health, with environmental work, whether septic systems, wells, restaurant inspections, and so on. And then in 2008, I came to Darien as health director. So my whole professional life, I've been in the public health field.
Excellent. Well, tell us about the size of your department. How many people work for you? I see a chuckle because I know this is an issue with your widening responsibilities and limited bandwidth, as they would say in the trade. How many folks do you have?
Well, right now we have myself as director of health. We have Mindy Shambrelli, who is our full-time registered sanitarian. We have a part-time public health nurse. We have a part-time food service inspector. He's about 12 hours a week. Our part-time nurse is maybe 15 hours. We share an office administrator with human services. And we have a very part-time grant-funded position that is for our emergency preparedness, public health emergency preparedness person. So really, we two full-time people for the department at this time.
And with all the growth that's going to be happening in town with new restaurants, the Federated Project, the Corbin District, the Palmers, whatever they do with their property. I know last year you sought additional personnel to help you out. Why do you need more staff?
Well, just this past year alone, there have been 37 new facilities, either that have come online, that's permitted in facilities that we permit and inspect. Most of them are food service. So that's it, in addition to what's already there, which is another 150 or so establishments. And, when you're doing new facilities, there's several components of additional responsibilities that we have. Plan reviews. We have to go through, review the specifications for the facility, review the menu, and make sure that the facility's capabilities and equipment is going to be able to manage what's being planned. And then we do in-progress inspections while the facility is being fitted, and then a pre-opening inspection. And then we do multiple inspections when a facility first opens. At least that's our goal, because we want to make sure that people who are working in these facilities basically know what they're doing and how to do it, and can prepare and serve food safely, and can work with the public and the beauty salons safely and know what they're doing. Right now, I think everybody is having issues getting qualified employees. And so we're also trying to make sure that we can provide education to employees for these facilities so that people who are working there, again, know what they're doing and can prepare and serve food and work with the public safely.
So you actually hold training classes
We
for
used
people that work in restaurants?
Right. We used to do it directly, but it was just too much of a drain on us. So we have a couple of online references for people that they can go to have their staff just do it at their leisure, at wherever and whenever they need to. And it's a proctored exam at the end. So for food managers anyway. So we want to make sure that we're offering the possibilities for these food facilities to get their employees trained. Right now, the health code does put the responsibility on the establishments to train their employees, but that doesn't really happen.
Mhm.
We can't expect that to happen, and that would mean then we'd have to review all their training programs. So that would be another component of our plan review process. So it is very time consuming to do all of that upfront work for all these new facilities. Now you said, as you said, Palmer's, we don't even know what's going there. The old Stop and Shop property, that's pretty well fitted out, and we're just starting to get information about the Corbin project. So far this year, I don't know if I said it before, 37 new facilities just this past year, within a year.
And those are what, restaurants, beauty salons, things like that?
Well, primarily they are food service facilities, but we've had 5 or so new salons come online. We have more salons now than we ever have. We have more food service facilities than we've ever had in the past. So that increases our regular mandated inspection frequency, number of inspections that we have to do over the course of the year. More facilities, more inspections, more plan review. So the upfront piece of it is considerable, and I don't see that slacking off anytime too soon. These projects are going to be ongoing for several years now.
So the restaurant food safety inspections are probably the thing that you do that affects most people in town on a regular basis. How often are restaurants inspected by your sanitarians?
It depends on the type of facility. Most they're classified depending on the perceived potential risk to public health. How long are foods held at temperature? So class 4 would be the highest risk facility. Your big, relatively big, I'll say Giovanni's, for example. They do everything, right? They prepare and hold and serve and salads and everything. They have to be inspected. That type of facility is 4 times a year. And if there's a facility that prepares and serves food within 4 hours, that's considered class 3. They're to be inspected a minimum of 3 times a year. Now, what we have too is we have a policy where if we're finding that a facility needs to be babysat, or we find that there's some issues within the facility, we do have the right to inspect more frequently. And we do have some places that frankly warrant more time than other places. All of our inspections for the class 3 and 4 facilities can be seen on our website. We do provide the most recent ratings and the detailed inspection report that can be viewed on our website. So if people are thinking of going out to dinner, before you go, we certainly encourage you to take a look at that. Our software that we use for doing the inspections uploads those inspections directly onto our website, and it's immediate. So,
and those restaurants do not know when you're necessarily going to show up, so they can clean up their act, so to speak, right?
No, unless a place, shall I say, fails or doesn't do well, we may say we'll be back maybe as soon as tomorrow. But yes, the routine inspections, we never notify. That is a random visit. They're always happy to see us. Welcome us in with, oh, gee, it's been a while, but yeah, so we do not notify people in advance.
So most restaurants, as you imply, are proud of the operation that they have, right? I mean, they follow the law, they do everything right, they have a trained staff. Is it safe to say that it's safe to eat in most Darien restaurants?
Yeah, yes, they're all open. We haven't closed them, and certainly, even for those places that we say we want to pay closer attention to, we haven't gotten to the point where we felt that their operation puts the public at sufficient risk to say you've got to close. So the answer to your question is, yeah, I think it's safe to eat at any restaurant in Darien. And if I didn't, they wouldn't be open.
And the Darienite.com does regularly publish your updated restaurant inspections if people don't want to go to the website. And it's always interesting reading, especially when there's an establishment that has not received top grades. You issue a report card which gives them a letter grade, and that report card is supposed to be posted in a prominent location at the restaurant, right?
Yes.
And what if you go to a restaurant and there's no report card posted? What are you supposed to do? Turn around and leave, or
as a consumer?
Yeah.
Well, I guess, if you got an A, I don't know why that wouldn't be posted. And we did last year, I think it was, add to our list of fees a failure to post the rating fee. So if a facility decides that they don't want to put a B or a C up, and we find out about that, we have the ability to actually issue I think it's $100 fine. It's not going to break the bank, but it's sort of like, you need to do this. Now, a facility, if they get a rating or an inspection that they feel is detrimental to business, they can request a reinspection. Mm-hmm. There's a fee associated with that, and they also have to provide us with a written description of what they've done to address the deficiencies that were noted in the inspection. And we will go back and we will reissue a rating. But I will say that doesn't happen very often, that mm-hmm. people request re-inspections. And in part it's because the facilities generally are pretty good. I think we have a very competitive area, and nobody wants to have a bad rating, because if the word were to circulate, it certainly, I would think, may impact business.
David Knauf, our guest today on Inside Town Hall. He is the town health director here in Darien. In addition to inspecting restaurants, you also look at cosmetologists. What are those?
That can be anything from hair cutters to hair coloring to nail salons to reflexology, footwork. My gosh, in the past 10, 15 years, the scope of services for personal salons has grown, and we're constantly learning about new processes. And it's challenging, to make sure that, the adhesives that are used for eyelash extensions, for example, are safe, and the materials used for nails and nail finishings are safe. A lot of the processes that are being done in these salons border on medical procedures. So, we're constantly checking to make sure that the people who work in these facilities are licensed appropriately. They have the training that they need to do what it is that they're doing. And in those cases where there are close to medical procedures taking place, that they either have a registered nurse or a doctor, as required by Connecticut code, either there or available on staff. And then, of course, we're looking at the sanitary conditions within the facility. You know, a lot of these nail salons have nail files, and we want to make sure they're not being reused on different people, unless, and you can't really clean a file, but you can autoclave other types of equipment and sanitize them. So
Autoclave
autoclave is a high pressure disinfection sanitization process for equipment that may come in contact with skin and cut skin. So you want to make sure that you're not transmitting any potential pathogens. So really, it's very important that this equipment be properly disinfected in between uses. You know, we have as a standard process, we do recommend people consider bringing their own equipment if they're going in to get nails done and whatnot. I know my wife doesn't, but you know, I still think that would be a smart thing to do.
What about the medical facilities that there are in town? I mean, Quest Diagnostics, I know Stanford Hospital has some blood draw facilities, et cetera. Are they inspected by you as well?
They are not. That they're all licensed by the state health department, but we do not get involved with medical spas, medical facilities, you know, or anything of that kind of nature. No.
Does the state health department inspect them regularly?
I'm not sure about their inspection frequency. I can't comment on that. I don't
know. Let's talk about COVID. The reason we haven't talked to you in recent years is you were kind of busy with a pandemic. And I think the town owes you and your staff and the folks that volunteered a huge debt of gratitude and thanks for leading the vaccination efforts that the state, the town, the federal government undertook. Give us the short 3-minute version of how you responded to when COVID hit.
The first phone call that I received about COVID would have been in February of, what was that year?
2020.
February 2020. And it was an individual was returning from Wuhan province, China, and coming to town. That was my first, and that was on a Saturday. So I got the phone call on a Saturday, and we had to you start with that monitoring and quarantine. We all learned about quarantine. We learned a whole bunch of stuff. You know, we learned terms that we had never used before. Now, you know, in our years of being in public health, we always had emergency preparedness, pandemic planning, and we had all these plans all set. And you know what? When COVID came around, it all went out the window. We had to reinvent the wheel, and we had to figure out as we were going. We had no vaccine. We had no personal protective equipment.
No testing mechanism either.
No testing mechanism. We had nothing but the knowledge about COVID. And at the beginning, there really wasn't any. You know, we had to learn, as I said, we were learning how to fly a plane while we were in the air, you know, so, and assemble the plane. So our first case in town was in March of 2020. And then they started coming fast and furious. And, you know, one of the big concerns that I had as we were leading up to more and more cases was, if you remember, the case counts were starting to increase just before St. Patrick's Day in that year.
Mm-hmm.
And so everybody was starting to get really anxious. And I was speaking to the first selectman at the time, and I thought, you know, I think it'd be a good idea if we closed our establishments prior to St. Patrick's Day, because, you know, we don't want to have that kind of spreader potentially happening. And the governor actually took the initiative, and I think it was on the 16th of March or the 15th, 2 days before St. Patrick's Day. That's when the lockdown occurred.
And we didn't know exactly how it was spread at that point either, did we?
We didn't know
whether it
much
was
about it.
contact or aerosol?
We didn't know. We figured it was because it was respiratory. I mean, it was always assumed that it was spread that way, but the actual determination of things like the 6 foot separating distance and so on, we really didn't know that, so I think that was the reason for shutting everything down. It was like, let's figure this thing out, and at the time there were no masks available and people were saying we should wear masks. And we had a group of volunteers here in town who started sewing masks like crazy and bringing them in and donating them to us. And what we did with them was, in turn, we brought them out to our senior extended living facilities. And we also provided them to those restaurants that were trying to stay open and provide takeout food, and to the grocery stores, because these are essential things that talk about, trying to keep us going as a society. We had to try to make sure that those people were being protected as best they could. So we were very fortunate in that we had this group providing us with the masks so that, we could at least keep getting food available to residents. But those were trying days because, as you said, there were very few answers, and yet people wanted answers.
And town hall was closed as well, too.
I was here.
Yeah, but a lot of people were told not to come into the office. They were learning how to work remotely as we're doing this interview on Zoom. Right.
We've learned a lot, and I think that, we used to drive hours to go to meetings in person, and now we can do it virtually. And there is a great advantage to this interaction that we didn't really have before.
Mm-hmm.
Learning how to work remotely, how to function remotely, have really good meetings in remote fashion has been one of the good things that's come out of the pandemic. And
so you initiated when the first vaccines arrived, and I forget when that was. This is something all of a blur at this point now. You initiated some of the very earliest vaccination programs, and they were held in the senior center adjacent to town hall. And I think you did the first 2 rounds of vaccinations, but then I think you've stopped since doing the boosters as well too. Why is the town not administering the vaccine or the boosters anymore?
Well, when we first started with the vaccine program, we were the only act in town. The vaccine was not being provided to physicians or doctors' offices or pharmacies, and so we were it. And so, and at the beginning, we were charged with providing the vaccine to really the seniors because there wasn't enough vaccine to go around. So we targeted age groups, if you remember. So, and the way the government, state and federal government told us to do it was have people sign up online. Well, the capabilities of that component of the population isn't necessarily savvy with respect to making, appointments online. So we did it all longhand. We did it paper, and we worked with the human services department here in town hall, and we reached out to our senior population in town and really made the appointments for them, got them in. And I have to tell you, Jim, it was in January of a year after that the pandemic began that we held our first clinics. And the seniors, this is for a lot of seniors, this is the first time they had any kind of interpersonal connection in a year. And it was just a wonderful experience to see how happy they were, A, to see people again, and B, to think that they were going to be protected by having this vaccine. And the other thing that I want to say about our clinics, was tremendous response that we got from the community to help out and volunteer, both from the greetings and doing the helping with making the appointments, and actually even the volunteer vaccinators. With the staff that we had, you heard the numbers, 2 full-time people, a part-time nurse, we never would have been able to do that. But we had tremendous response from the community, and we were able to pull off at the end of the day 65 clinics, 9,000 doses. So what happened was, you ask about why we're not doing boosters. The first round, we were the only act in town, like I said, so that ran from like January. Things started dropping off in, say, April. The case counts went way down. People got vaccinated. And then, so we didn't do any clinics. And then in the fall, the boosters came out. And we really initially weren't planning on doing clinics in the fall, but the demand was there. People were asking for it, and there still wasn't that much vaccine available elsewhere. And so we did. So that we did do boosters in the fall of 21. And all of a sudden, the demand evaporated again. And it evaporated in part because everybody got vaccine, meaning distributors, our CVS, our Greaves, our, Walgreens, the clinics, the Norwalk started having these clinics, and Stamford had clinics. And we were doing things like for a couple hours, couple hours a day, a week. And you could go to Greaves anytime and get the vaccine. You can go to CVS anytime, Saturday, Sunday, whenever it's convenient to you. So at that point, there's no reason for us to do it because it's available in so many other locations. People stopped calling us. We had vaccine available. We actually worked out a deal where we had leftover vaccine that we gave to our local pharmacies because we weren't able to distribute it because nobody was asking for it anymore. And they're still not.
David Knauf, is the town health director here in Darien, and he is our guest again on Inside Town Hall. There's a COVID testing facility that, as of the recording of this program in early December, is still open at St. John's Church. Do you anticipate? I know that's not one of yours; it's a state facility, I believe. Do you anticipate that staying open in case there's an upswing in cases? Have you heard anything?
I get reports from them every week, and I am in conversations with them regularly to ensure that they let us know if they're planning on closing those things. I have heard from the state health department that state health department are going to be closing them at some point. When that is, I don't know. And I do know, and I can say without a doubt, that the demand for testing has also really dropped considerably. So I wouldn't be surprised if it doesn't happen soon. Right now, and kind of transition a little bit in this conversation, I think we're not really seeing much COVID, but we are seeing a lot of seasonal flu and the other respiratory diseases. So COVID right now, and tomorrow we'll be doing our monthly report, which we routinely do and post on our website to show and demonstrate the kind of the prevalence of and the kind of the cyclic nature of COVID. But right now it seems as though there's a couple other issues, respiratory issues, that are taking precedence over COVID.
But with the holidays, Thanksgiving, Christmas, New Year's, more people traveling, etc., the mask requirements of the TSA having been abandoned by court order, I think it was in April of 2022. COVID's not going away. People may be getting very mild cases, but are you suggesting that if people get what they think is a cold and they can do a self-test at home, they should follow up with a PCR test at the St. John's facility?
Well, if they get a positive test at home with the at-home kit, yes, I would suggest that. And I think that's primarily what they're seeing there as their clients right now.
Are the at-home tests accurate, or do they give false negatives? In other words, they say, no, it's not COVID, but it may actually be COVID.
I'm not sure as to the efficacy, like percent, effectiveness, or what that is, but I have to believe that because they're still pushing these things out, that at least the ones I have, the iHealth, are pretty good. I do know that there have been some that have been pulled because they're not as effective. So, I mean, like with anything else, you never know.
You and I guess some other town health departments were recently recognized by a gubernatorial proclamation. And I think you just have it at hand there. I hope
I do. It just so happens.
Just happened.
Just so happens that this is a signed proclamation from the governor. It's in recognition of National Public Health Workers Day. It says, I, Ned Lamont, take great pleasure in honoring and recognizing the Darien Health Department on November 21st, 2022. And basically goes through outlining all of the things that we do on a regular basis. And in addition to that, what we had done during COVID response, which was remarkable in that, we've never done anything like that. In my career, the closest thing to it, I guess, was H1N1. And that was really nothing compared to this, anyway, yeah, this is a great honor, and I'm very pleased that the governor has finally recognized the work that, not just us, but all local health departments had done in the response to the COVID situation.
Well, congratulations.
Thank you, Jim. Thank you.
Well deserved.
Thank you.
You're also involved in doing some interesting DNA tracing of potential COVID in our community that we may not even be aware of. How does that work?
Are you referring to
Yes.
this publication? Okay, this is actually has nothing to do with COVID, but it has to do with our beaches and our water quality, that pertaining to shellfishing and beach closures.
Perfect segue. I'll take it. Let's go.
Let's go
Tell
for
us
it.
about this. Yeah.
So from Memorial Day to Labor Day, the health department does water sampling at our beaches. And, we take it and collect it, bring it to a lab. And then the next day we get the results back. That's 24 hours. That's 2 tide changes. So the water that we collect on, say, Wednesday, we get to find out if it's safe on Thursday, which means that if anybody's swimming in the water on Wednesday and it's bacteriologically unsafe to swim in, we're not going to know about it until a day later. So we've been talking about this. Some of my colleagues and I have been talking about it, and came across this new technology called DNA source tracking. And what that does is you analyze the bacteria you find in the water and try to figure out where it's coming from. Is it human? Is it dog? Is it deer? Is it rodents? Is it birds? Is it geese? So what kind of a public health impact does the bacteria in water pose to swimmers? And right, we have a policy of closing the beaches whenever we receive more than an inch of rain, because we know through studies that we did that when you get more than an inch of rain, bacteria counts in our beaches exceed the EPA and state guidelines for bacteria. But what are those bacteria? We don't know. So a few years ago, before COVID, we collaborated with the Westport Health Department and the East Shore Health District, and we analyzed 3 watersheds in Connecticut. And it was the Scasco Brook, Lower Farm River in Branford, and Goodwise River here in town. And for a year, we took water samples and sent it in, tried to check the DNA. We collaborated with Yale University and with Harbor Watch and the Connecticut Agricultural Experiment Station, and put together a report. And this I'm very proud of. This is, and pleased to say, is the front, it's not front page, it's the cover article for our research paper on the DNA source tracking that we did, as I said, as a collaborative effort with the 3 health directors and others. And
What did you find? What did you find was in the Goodwives River watershed?
We did not find, let me tell you what we didn't find. We didn't find significant human bacterioids. But what we did find were that the trackers and the DNA that we had really didn't help us determine what was the source, because we didn't have the trackers for rodents, for example. You know, we didn't have that DNA. We were kind of limited in our budget here. And so what we're hoping is that with the publication of this article, we're actually lobbying for additional funds to take this a little further, because we really think that the current method of doing water testing, getting the results back a day later, is a little archaic and really is not protective of public health. And if we had this ability to do source testing, we would know and could know much more rapidly what is the source and what is the potential risk to human health.
And this assumes that if you know the source, you can go back and try and stop that source from getting into the water supply?
And that's the absolute exact reason for doing this. So if we find, you know, in the Farm River, the concern was there's farms there. It's interesting because the 3 watersheds that we chose are very different. Right. Ours is primarily an urban area. The Farm River in Brantford is primarily a farming area, and Scasco has a little bit of everything. You know, so we thought that having those 3 different characteristics of drainage areas would be really illustrative to see what differences and similarities we found. But what we found was that we really need to get a better handle on what we're using as our comparison DNAs.
So if you found it was, let's say, goose poop that was infecting the water at our public beaches, what are you going to do? I mean, you're going to eliminate the geese. How do you keep the goose feces out of the river?
Well, between the geese and the seagulls, you know, that's just part of our natural environment. But, you know, I don't know, and I've done some research on this, that there are an awful lot of public health directly resulted illness associated with geese or seagull poop.
Yeah.
You know, I mean, I'd go to the beach where I used to live, and the beach would be absolutely covered with seagull droppings. You know, and you know, that's just what happens, and that's an ongoing concern. You know, geese and geese in fields and geese, you know, in our parks. Tilly Pond had a problem with the geese. You know, and we're constantly trying to figure out ways to humanely keep the geese away. But you know, that's part of why we like living here too, you know, is that we do have some wildlife around us. Kind of like mosquitoes, you know, it's like, you know,
yeah,
can't live near the water without mosquitoes.
Right. Well, we'll have to revisit that in the spring and the summer when mosquito season comes back. Speaking of contamination, what about the septic systems in town? Some people are not on the sewer system, but they have, you know, septic tanks on their property. Where does that go? The human waste that goes into the septic tanks?
Well, it's a very important part of what we do, is to make sure that the septic system, the tank and the leaching systems, are functioning properly. We don't have an awful lot of new construction here in town, but we do have a lot of rebuilds of existing homes and tear downs and rebuilds. And every time that occurs, we do a complete evaluation of the existing septic system. And if it is something that we don't have much information on or is out of compliance with today's code, it needs to be rebuilt. So we're in the process during the course of this, when you see these big reconstruction projects going on, most of them are getting septic system replacements done that conform with today's health codes. And it's can be challenging at times because some of our, you drive around town and there's a lot of rock, there's a lot of ledge, there's brooks everywhere. We have high water table. So, we do have our challenges with some of these properties, but so far we've been able to make it work and get septic systems in that are, if not code compliant, there's allowances made to ensure that there's not going to be any kind of pollution impacts. We've done a lot of that rebuilding along the coast in particular. A lot of septic systems have been rebuilt there because there will not be sewers brought in a lot of areas of town. And, I'm an advocate of septic systems, frankly, because, if you have a problem with a septic system, it's generally localized and you can pretty much take care of it on site. But if there's a problem with a sewage treatment plant, there can be 100,000 or 200,000 gallons of sewage discharged if the plant's not working. That's going to have a far bigger impact on our environment than a septic system here or there. So I definitely am a advocate for on-site sewage disposal.
And many people may not realize it, but the sewage system in Darien actually gets pumped over to Stanford.
Yes.
For treatment. So
yes.
I assume you keep in touch with the folks in the health department over there.
Anytime there's a sewage overflow in Stanford, I am notified.
Mm-hmm.
So if there's a problem with the pump station or with the sewer plant itself, where there's untreated or inadequately treated sewage being discharged to Long Island Sound, we're notified. The good news about that is that it's far enough away that it really doesn't impact our beaches directly, but it does have impacts on shellfishing at times. And the shellfishing piece of it, again, at water quality, that's monitored by the state and Aquaculture, Bureau of Aquaculture, which is actually part of the Department of Agriculture. So they monitor our shellfishing areas.
A lot of people keeping an eye on our health safety, including our guest today on the program, David Knauf, who is the town health director here in Darien. Some people do not get their water from Aquarian, now part of Eversource, the ever-growing utility that controls our electricity and water. They actually use wells on their property. And are those inspected as well too?
They are not. In fact, that's an issue that I'm glad you brought up, because we do want to encourage people to get their water tested periodically. There certainly are variations that occur in water quality over periods of time. And, our public water supplies are tested routinely and frequently. But private wells, if there's any testing of a private well done at all, it's usually required to be done by a bank or a lending institution at the time of real estate transaction. The State Department of Public Health tried to get legislation passed last session, and they routinely do this to mandate testing of wells in conjunction with real estate transactions, along with having laboratories who do those tests submit the test results to the local health department. And the mandated part of it did not get passed, but the requirement that if a laboratory does a test, even if it's for a real estate transaction or for any reason, that the lab is supposed to send the results to the local health department. we get them periodically. And then if there's any issues with the water quality, we'll follow up with the homeowner.
If
Make
you have
recommendations.
if you have a septic system and a well, you should be uber cautious, I would assume.
Yeah, well, I think that you need to, again, it's your responsibility to make sure you maintain the septic, get it pumped, every 3 to 5 years, depending on the size of the tank, and maybe even more often if you have a garbage disposal, because garbage disposals, you're dumping a lot more solid waste into the tank than otherwise you would. But you have a responsibility to take care of your infrastructure, just as you would take care of your furnace. So you get the tank pumped, get it serviced, get a report, see how well, how it's functioning. And then also, as I said before, it's a good idea to get your water tested. So, it's up to you, homeowners, to take care of your infrastructure.
Let's segue from water safety into indoor air, which has become an increasing issue since we became aware of COVID. We were for decades trying to make our houses tighter,
Yeah.
less air infiltration. And now the whole idea of being able to open a window is, very smart, it seemed in retrospect. Something Metro North has been trying to figure out as well too, because they don't have windows that open on trains as well too. What are some of the things that people should be aware of about the quality of air in their homes?
First thing I think that people should know is that, you have to make sure, again, we're talking about infrastructure, get your furnace serviced. And when you get it serviced, make sure that the air exhaust is adequate. So we're not having any potential issues with carbon monoxide and, improperly functioning furnaces. That's a big concern, is carbon monoxide. The other thing with indoor air quality is, especially if you have rooms that are finished in the basement, radon test, get a radon test done.
What is radon?
Radon is a colorless, odorless gas that kind of comes out of the ground, out of the earth, and really is pretty well localized to where it's shallow to bedrock. For some
So
reason,
areas like Tokenique, which is built on rock and doesn't have a lot of soil, might be prone to radon, but
might be.
It could occur in other parts of town as well too, right?
Yeah. Well, the thing is that for years now we've had a partnership with the state health department to get radon test kits and distribute them to residents for free.
Mm-hmm.
And I'm very pleased to say that, the test results that we've found, and we've done literally hundreds of tests in town, all over town. And our numbers are not that high, even with the shallow to bedrock, unlike other communities that are not even that far away. So generally speaking, I don't see it as being a community problem, but we still recommend that the testing be done, because radon mitigation is not terribly expensive. It's not hard to do. It's basically positive venting in the basement.
Like a little fan to draw the air out of the basement.
Pretty much. It's really pretty simple. It's not that expensive. It's not that invasive, and it can take care of what otherwise would be a potentially serious health hazard. According to the EPA, radon is the second leading cause of lung cancer to cigarette smoke. So I think, you'd be well advised. We will be having more test kits soon. State Health Department has promised us some, not sure exactly how many some are, but they'll be free. And if we don't have them, you can go to the hardware store and get them. They're not that expensive. And
it's just a little thing that looks like a Roach Motel. You open it up and you leave it in that lowest space in your house for a few days, and then you seal it back up, put it in an envelope, and mail it off.
Exactly.
And you get the results, right?
It's very simple.
Yeah. Uh, Given the amount of flooding that the town has seen in recent years, with no signs of those kind of 100-year storms letting up for another 99 years, a lot of people have had problems with mold. Um, that's not something I guess that you would inspect, but you can hire professionals to come in and do mold inspections. Why should people be worried about where water has infiltrated their homes and maybe caused mold? Partly because it's not always visible, right?
Well, a lot of mold will grow behind surfaces, like behind sheetrock, and if you clean it off the surface that's exposed, it can still be growing on, behind the wall. So yeah, that's part of it. You mentioned flooding, and I do want to speak about that a little bit, because floodwaters contain lots of stuff. It's not just a stream that's overflowing. We talked about sewage before. Chances are, our sewer system is going to be impacting floodwaters, as well. There's going to be some component of sewage in there. There's going to be everything that's on the surface of the ground washing over in the floodwaters. So bottom line is, don't walk barefoot through floodwaters. And especially if you've got a cut or anything, always wear boots. If you're cleaning up after a flood, always use gloves, boots, and I would recommend goggles as well. You just don't want to have this stuff splashing in your face. Mold is one concern, but floodwaters are another. And, I see this, in some of the recent videos of the Florida hurricane, where his fella's swimming in floodwaters on the first floor of his apartment or his house. It's like, okay, I don't know if he's okay, but that's not a good idea under any circumstances. So, have some respect and consideration that floodwaters are not just water that's flowing over the surface of the ground, and it's going to contain everything that's being flushed off whatever's on the ground, dog poop and everything else. We talked about geese poop. It's got everything, parking lot debris. It's not clean water by any stretch of the imagination. But yes, if you're going to clean up after a flood, always consider that you have to sanitize and disinfect. Another thing I want to mention, never use ammonia and chlorine solutions products in the same space. You can generate a gas that can kill. So know what you're using when you're disinfecting, and make sure you're not mixing the two together. That's, again, chlorine and ammonia can generate toxic fumes.
Well, I think we've certainly frightened our audience today with the many aspects of their lives that may come back and bite them in various portions of their anatomy. The show is inside Town Hall, and before we let you go and get back to protecting the health of residents in Darien, you wanted to mention an initiative that's going on inside Town Hall to deal with emergencies that might occur there.
Right. We are in the process of establishing a medical emergency response team with town hall staff, so that in the event there's an emergency, or, a resident or a staff person, if something should happen, they collapse or get hurt or something like that, that we can respond immediately and kind of provide some help during that period of time in between the event occurring and when the first responders get here. That's, I think, an important role that we're going to be establishing. The other thing that we're doing is our public health nurse has been trained as let me get this right. She is a certified mental health trainer, and we're going to be starting to offer mental health classes after the first of the year. We're cognizant of the stressors of the times, And we want to, again, expand what it is we do in conjunction and cooperation with our human service department. Being able to provide mental health training for residents and the public. Tick testing, you can send your ticks. Ticks are around year round now. So if you find a tick that's on your body, you can send it in directly. We have the forms on our website. So you can go to our website, darionct.gov/health. The forms are there. You send the tick in directly to the ag station. They're really good. 3 to 5 day turnaround. You get your results. We're also developing through the federal funds for COVID response, pod in a box, which will enable us to immediately disperse and get to a place to set up a clinic if we have to in the future. When we first started working with COVID, we had to figure everything out from the beginning. But we're gonna have a setup where we're gonna be able to offer clinics remotely. That's a project that we're just starting to work on now. And one final thing that I would like to say is, I mentioned that we do track reportable illnesses, diseases, and conditions here. We know how many cases of COVID, we know how many cases of flu. This year, and also STDs. This year, oddly enough, in the last few years, we've been seeing a trend in increased mercury poisoning levels of residents. Yeah, I see that look on your face. It's like, what's that about?
Sushi?
Yes.
Whoa.
There is a definite link between certain fish and elevated mercury levels in people. So if you're a frequent lover of sushi, swordfish, and we have an advisory, again, on our website, kind of like a recommendation of what fish to eat and how frequently you should have it. Totally recommend that you look at that because, I don't know what level of mercury you need to have before you start having impaired response to the mercury levels because it affects your nervous system. But the levels that we're seeing are reportable levels, and it's up there near our seasonal flu numbers this year, and that's odd. That's very unusual. And I also know that not all doctors test for that when they do blood tests. There's a few doctors who seemingly find this on a regular basis because they're looking for it with their clients, with their patients. So I just want to let people consider the fact that if you're a frequent eater of seafood, next time you're going for a blood test, have a mercury test done as well and tell your doctor that you like sushi, you like seafood, and you just want to make sure you're, not having elevated mercury levels. Be aware of it. So,
wow.
Yeah.
Wow. Well, David Knauf, our guest today on the program, inside Town Hall, and we have just spent the last hour covering what his tiny little editorial comment, understaffed department does to protect the health of everybody here in town. David, I thank you for your time. Please share with your department my personal gratitude and that of everyone else in town for all that it is that you do.
Well, thanks for the kind words, Jim, and I'll be more than happy to spread the word. Thank you.
Excellent. Excellent.
Okay.
And thank you, our faithful viewers, for watching yet another edition of Inside Town Hall.